Side effects to CBD. Hi, my name is Jamie Hatfield and I am a registered nurse, a functional medicine expert, a clinical director, and educator who specializes in anti-aging. I am the founder of Legends Health, Wellness, and Performance, and I have created a 100% organic, non-GMO CBD product line so you can live a happier, healthier life. Just like anything we put into our bodies, cannabinoids found in cannabis all affect our bodies differently. Some of us react to certain substances better than others, and others may experience a completely different experience and may have different side effects. Now, if you're thinking about making the switch from painkillers over to CBD, or if you're just researching it as a daily supplement, it wouldn't hurt you to become more familiar with the possible side effects and outcomes you may experience while using CBD. So some of the uses of CBD have been extensively studied in regards to the health benefits. We have evidence that CBD treats chronic pain and inflammation, and it also works on the digestive system, aiding in insulin resistance to reduce blood sugar levels. It has also been support for nausea and vomiting and helping contractions of the small intestine. This is due majority because we have a lot of CBD2 receptors in our gut. It's also been shown to be a potent anti-anxiety reliever, and we've seen that it kills cancer, and it helps with skin conditions like psoriasis and hives when taken topically. Now, many elderly people are actually loving it because it's helping with bone mass and pain. And the rage today is anti-aging. And CBD has high antioxidant properties that are helping with skin and helping people with acne and breakouts and actually even more youthful skin. Check out our CBD infused face masks. So what are the side effects now of CBD? And now I told you it affects everyone a little bit differently because our bodies are a little bit different from each other. Now, in most cases, when using CBD oil, it might not affect you at all, negatively at all. CBD doesn't really have any major side effects or reactions because it mimics your own signaling molecules in your body. Now, the most common side effect that you may feel is a feeling of sluggishness or slowness. Or you might feel, in that case, you might want to decrease your dose. And I go a lot in detail about dosing on another video. Now, it's unlikely for you to actually break out in a fever or hives with CBD. Those are the most common side effects. The most common side effects are going to happen with your mood because it affects the neurotransmitters in the brain, GABA and serotonin. So this is why you may feel that you go into a deeper depression or have more anxiety or racing thoughts or are trouble focusing or have more drowsiness. Or you actually may have a change in your appetite or have some gut issues that you're experiencing, digestive issues such as diarrhea or constipation and nausea, dry mouth and dizziness, even actually sometimes a little bit of vomiting. When you're taking edibles, you may have an increased liver enzyme, and this may cause damage to your liver and inflammation, and usually you get that when you're taking edibles. Now, most people will not have any side effects to CBD, but in the majority of the time, they're actually having side effects to the fillers and the toxic chemicals and the oils that people are actually using in their products to extend shelf life or the extraction method they're using completely. Many companies will put in what's called citric acid or xanthan gum, or they'll put artificial flavors. Now, many nano-emulsion CBDs I have personally seen are packaged in plastic bottles. This is a no-no. That CBD is adhering to the plastic, and you are not getting your CBD, and you're getting exposed to PPA. Now, plus, a lot of these, when they're taking it nano, they're using polysorbate to break it down and into a smaller sized particle. And in my opinion, I have a mixed feelings about this, even though I think nano-emulsion is actually a fantastic product. So please check the ingredients out. If you can't pronounce it, When you're looking at the ingredient label, don't use it. And if it has fillers, there's no need to actually have fillers in a CBD product. A lot of times in functional medicine, when people actually do put these fillers into products, we go and put people in IV chelation, and which means we're clawing out some of those toxins, and they have to get IV therapy. Now, other safety concerns taking CBD to look into to see if it's actually right for you. There's a couple other precautions you should keep in the back of your mind. One, if you are pregnant or you're nursing, I suggest don't taking CBD for a short-term exposure during your pregnancy, because we have found that it has increased permeability and placental barrier, placing the fetus actually possibly at risk due to the substances. Now, women, you do need to know that your breast milk actually has cannabinoid enzyme signaling molecules in it. If you've ever consumed a cannabis plant or not, you already have those innately in your body. So I'm currently telling you to advise staying away from that. Now, second, CBD oil can interact badly with several different prescription medications, including anti-epileptic drugs. So be sure to talk to your doctor before switching over to CBD entirely. Now, CBD oil is not a sleep aid. Do not take it to fall asleep. Take it as a daily supplement to improve your sleeping habits. It's not an end-all be-all supplement. If you're concerned about having adverse reactions from CBD, be sure to discuss this with your doctor, because it does affect those neurotransmitters in the brain, like I was telling you. And the biggest thing is the gut lining, and that may actually cause an upset stomach. So that's a possibility that you may find. Now, our desire at Legends Health, Wellness, and Performance is to help educate you on anti-aging strategies and provide you with a high-quality CBD products to help you create peak performance and contagious energy. Thanks for watching.